Periodontology. How effective is periodontal graft surgery? I hear stories about people that have gotten a skin graft only to have their gum line recede again after a few months. Is the surgery worth the money/nuisance? Or is better dental hygiene enough to stop gum line recession?
Great question. So I'm going to kind of reverse the question and answer in the order which will make better sense. So is better oral hygiene or better dental hygiene just enough to stop the gum receding? Yes, definitely good oral hygiene is important enough to stop any further gum receding. However, if you already had gum receding, it's not going to fix the problem. So just the good oral hygiene itself, it's not going to fix the problem. So to fix the existing gum receding, you need to have some kind of a gum grafting surgery done. However, after fixing your gums with the gum graft, you need to still practice good oral hygiene, otherwise you will still get the gum recession back again. So to answer this question here, so is it worth having gum surgery done? So let me ask you this question: is it worth having a tooth in your mouth? So if you answer the question yes, it is worth to have your tooth. Particularly, a lot of times I see the gum receding in the lower front teeth, which is one of the most common areas. People have a lot of tartar buildup, which causes the gum receding. And then we have also what we call as a frenum on the inside that causes the gums to pull away from the teeth, which is one of the common reasons why I see in my office people lose their front teeth and why they need to have the gum grafting surgery done. So if you answer the question, it is critical for you to keep your front teeth or any other teeth that have gum receding, then you answered your own question. So it is necessary to have the gum grafting done. So going back to the question again, so if you thought it is worth to have the gum grafting done to keep your tooth, so then what happens and why do you get gum receding again? If you got the gum grafting done, and it is one of the reasons why you got the gum grafting or gum receding, because you never went to the dentist and you did not take care of your teeth. So then if you continue the same thing after getting the gum grafting, you don't go to the dentist, you don't visit your periodontist, you don't practice oral hygiene, then you are going to end up having the gum graft fail. So imagine you smoke and you drink, and then you don't exercise, and you have a history of heart disease in your family. Now you got a heart problem, now you had a heart attack, and then you need to have a bypass surgery done. After you fix your heart and after you had the bypass surgery done, then if you continue the same habits, smoking and drinking and not having a good lifestyle, then you're going to get another heart attack. The same problem. So with the gum disease or the gum grafting, if you already had gum grafting done for the reason that you had gum receding, and if you don't follow through with good oral hygiene, and if you don't follow through with going to the periodontist on a regular basis, yes, you are going to have those gum grafts fail. And one of the other common reasons why the gum grafts fail that I see in my practice is patients don't wear the night guard. So one of the main reasons why the gum recession happens, gum receding happens, is because they have a heavy bite force, and the teeth are clenching, or they're grinding their teeth. They're putting heavy force when they bite down on their teeth. If you wear a night guard, when the forces get distributed evenly, you don't run the risk of having the gum recession again. But if you don't, then you will end up having recession. Now, I'm just pointing out one reason. There are multiple reasons to why we call it as aggravating factors. So you need to fix the aggravating factors or factors which cause exacerbation of those gum recession. You need to fix those factors in addition to fixing the gums, so that way you continue to have the same healthy gums.
Keep yourself healthy. Keep your gums healthy.
Yes, sir.